to take up the services that are made available. So that in itself is a big challenge in the national response to HIV and AIDS. That each stakeholder, all the stakeholders in the national response continue to face. So this is why it is important that for somebody to be HIV infected, it is not synonymous to a death warrant. There are interventions, there are services that when a person, when made available to that individual, would definitely make a difference in the life of that person. So, but we still realize in our national response that people who are infected or in some way affected by the disease continue to be discriminated against, and they continue to be stigmatized in our societies. So that has been one main challenge. He has also, you know, it's obvious that resources, because the response is quite costly. And now that you've made mention of support from the Global Fund and of course the government of the Republic of the Gambia, under the dynamic leadership of His Excellency, his Professor Alhaji Dr. Yahya Ejevijan. That notwithstanding, we still have gaps in funding the national response. And you know, we understand there is a global financial crisis. And if your main funder is the Global Fund and the government of the Gambia, and there is this national economic crisis going on, you definitely would expect a cut in your budgetary allocations, and this is what we are seeing in our national response. So we still need resources in our national response to HIV and AIDS. The government is doing a lot, but we're still calling on more stakeholders to join, because it is something that need or requires all hands on deck to make this national response very, very effective. And there are numerous challenges, you know, apart from, and then one of which is we now trying to explore other possibilities of having alternative sources of funding. You know, and for now,
what do you intend to do?
Yeah, we're trying to engage more partners. Like I said, for now, the national response is basically funded UNAIDS, the government of the Gambia, and the Global Fund. You understand? But we want to expand more. The UNAIDS is giving us all the technical support. The other resources are also coming from other two partners, including the government of the Gambia. But it's not enough. If you look at the response, it's quite costly. HIV medication, as you may be aware, is one of the most costly in health. So.
Okay, thank you, Mr. Baji. Mr. Nua, as a UNAIDS country officer, are you getting somewhere by gaining what you want to get from these people who have the stigma, or people who have the infection, or the general public as a whole?
Yes, I think the future looks very bright despite all the challenges that we have.
That's a good news.
In 2011, at the United Nations General Assembly on HIV, commonly known as the UNGAS, where the targets for universal access were reviewed and new commitments were made. UNAIDS, worked with key partners and agreed that, we should scale up, universal access to HIV prevention, treatment, care, and support, and set very bold and ambitious targets that, by 2015, we should eliminate new HIV infection. By 2015, we should ensure that, 0 people are dying of AIDS-related illnesses, and by 2015, we should have 15 million people on antiretroviral therapy. I must say that, under the current program, as part of, the commemoration of, World AIDS Day, UNAIDS, in partnership with WHO, launched the Global AIDS Report. And the report clearly indicated that there has been significant reduction in new infection in a number of countries. There has been significant increase, in the number of, services that are geared towards, ensuring the reduction of transmission from the mother to the child. Countries that have significantly contributed to this included, Botswana, Namibia, and South Africa. And Pa Osman also mentioned in the Gambia that we have 10 centers that are providing antiretroviral therapy. We have, close to 30 centers, that are providing voluntary counseling and testing. Likewise, we have over 30 centers that are providing prevention of mother-to-child transmission.
Okay.
Now the challenge we all have is, what can we do to consolidate these gains and even forge ahead despite all the challenges that we are facing?
Okay.
The future looks very, very bright, and I think that's the commitment that we have come up with, so that we renew it on December 1st, to say to everybody that we can and we should ensure zero new infection, and the road to getting zero is becoming brighter and brighter.
Wow, that's very good news. I must applaud you for that good job, and thank you very much, Mr. Sise. Coming to Mr. Ba. Mr. Ba, as a program manager, I mean, there are so many people, when they have this illness, they don't want to come out. What are the ways that you put in across to make these people feel that this is a disease and I have to go and get cured? What are you doing?
Yeah, this is not an easy question to answer.
Okay.
This is not to say that is focused on health sector response, because you are talking about people not coming maybe because of certain reasons.
Yeah, because maybe some people are discriminated
because of stigma and discrimination,
yeah.
and which is one of the themes, if you look at it, zero stigma and discrimination, because the stigma is actually creating a lot of problems, preventing people from accessing services, and it's one of the biggest challenges that we are facing.
Expensive.
And it's expensive, and it's not easy also to eradicate. But we have been, like Dauda said here, they have so many activities, community activities, which they are actually implementing, trying to demystify, HIV, showing people that HIV is just like any other infection, and it's not to say that you have HIV does not mean that it's a death warrant.
You are not part of this.
So and that is even more serious when you come to the facilities. Like if you look at the services that we are offering, despite the fact that we are scaling up services, like for HIV counseling and testing, which is free of charge, people are not coming forward. It's very low for people who are coming for voluntary counseling and testing. Why is it low? Because of maybe people, fear, because of maybe stigma and discrimination. If I'm infected, what would my people do to me? So, and we've seen...
Yeah, because, I mean, some people will say, this guy have AIDS, so I will not sit with him, or I will not talk with him.
Yeah.
So that's the reason why I asked that question.
Yeah, because it just goes back to the attitude of people towards people living with HIV and AIDS. Whenever you talk about HIV and AIDS, people don't want to associate with that individual. And that is what is causing a very serious problem, and is actually taking our response behind. Because now is not the time to blame each other.
Yes.
We should come together and help each other so that we solve the problem as a whole. They are not a problem. The people living with HIV, they are part of the solution.
Yes.
But if we discriminate against them, then we will surely not, get ahead with what we want to achieve.
Mr. Diouf, what would you like to add on to that?
What I would like to add is that in terms of stigma and discrimination, a lot of the time there is ignorance. People don't want to talk about it. And we must come out and talk about it. It's just like any other disease. For example, leprosy was here, even tuberculosis. But with awareness and the fact that there is hope, like was already mentioned when the UN report was launched, infection has dropped, and that in this country we have services. And
that's just that people go to work.
Yes. People can live longer, and there is hope. So this is one of the things I just want to, put across.
Okay. Well, I won't leave you there, Mr. Diouf. You are a program manager at the Action 8, and Action 8 is a stakeholder when it comes to so many programs and initiatives that people have, and when it comes to health, Action 8 is always there. But then with this global fund crisis nowadays, Is it